The first thing we must know about SMN2 copy numbers, it's not exact science today, and there was a very interesting paper published recently in Neurology where the German group compared the data of SMN2 copy numbers between different labs and found a very huge discrepancy from lab to lab. And we observed the same feature in Belgium when we compare our data using different methods. So today what we call a patient with 4 copies, in different lab it may turn out that the patient has 3 copies of SMN2. So to make it a very strong point for decision making is probably a little bit too early before we have standardized the assessment across the different labs. Nevertheless, it's an important factor, the number of copies of SMN2, and it has to be taken in consideration in the risk-benefit assessment for a single individual patient. It is clear that we will not be likely to take any risk in a presymptomatic patients with 4 copies of SMN2 because these patients may develop the symptoms at the age of 10 years, 20 years. We still don't know exactly what is the median age at which this patient may present the first symptoms of SMA. So it means that in the individual risk-benefit assessment of patients, number of copies must enter into account, but cannot be today the only factor to take into consideration. In Europe, there are not a strict guidelines about how to use this information in the care of patients, and the criteria of reimbursement of nusinersen, for instance, is very different from one to another country. So it's very country dependent, and inside the country it can also be physician dependent.
Talking about number of copies and about the treatment. There are some recommendations that said that the more copies, if for a patient with 4 copies, it is recommended to wait before treating, before deciding to treat. So it depends on the country. There are some countries that are waiting. I saw also some posters, I think in Germany, they were talking about their experience for those that waited, that they didn't treat right away because they didn't have 2 or 3 copies. And then is also, these patients have to be frequently followed up to decide at what point are you going to treat these patients or not. So it can be controversial or not, but I think it's difficult to have the same response that would be considered as a criteria. So it's something that has to be discussed, and it's an open question that has to be assessed case by case. I think there are two aspects that have to be considered for neonatal screening. So one would be, yes, the delay of between the blood sample and the results, and the other one would be the availability of a lab to do this testing. So I think that it's something that is not yet available everywhere. It's difficult to say which is more important. So I would say that at first there have to be more more countries that could implement this screening, this newborn screening, and then exactly each country or each department, each region should think about how can they do to improve and have a shorter period between the test and the result. So there are 2 approaches, and the most important one is to have this test available.